Good morning, Bill Bergfeld again. I want to attempt this morning to talk a little bit about this concept called Medicare. I want to try to explain it a little bit without all of the legal and technical jargon. I want to talk about parts A, B, C, and D if I can, and help you understand it just a little bit. I want to start off by telling you, I know you got the envelope, the one that says that it's got Medicare inside. It's about phone book thick. It's one of those things. It's got all kinds of letters in there that you've never seen before. It's got Part A, Part B, Part C, Part D, Medigap, Advantage, and it's got all kinds of stuff in there. And somewhere in the middle of reading it, you're probably like I was. I got lost. I've got a deadline I've got to follow with this, and I still don't really understand what I'm signing up for. So I wanted to try to explain some of that if I can. And so if that's kind of where you are with this, then stick with me. It's in the next few minutes, I'm gonna walk you through what I feel like each part covers and what it may cost and how they kind of fit together. And I'm gonna try to do that in plain English. So let me start with Part A and Part B. That's the foundation part, I think. Part A covers primarily your hospital insurance. It covers the inpatient stays. It covers skilled nursing, hospice, that kind of stuff. Most people get it premium free because they paid Medicare taxes for 10 or more years, and it's the number one relief point, I think, as far as this foundation portion's concerned. That's Part A. Part B is a medical insurance type thing. It covers doctor's visits, outpatient care, your vaccines or your preventive services. It covers durable medical equipment. This one does have a monthly premium. And in what I understand, in 2026, the standard premium is income based. And the way you kind of check on that is go to the SSA.gov site for their exact number for your situation, for you. That way I don't get in trouble here trying to quote some kind of figure for you. So together, Part A and B, the original Medicare, it covers basically hospital insurance and medical insurance, that kind of stuff. The 20% insurance gap in Part B. This is the thing that nobody warns us about. And it's exactly why Part C and D, the Medigap portions, even exist. Original Medicare alone leaves those gaps. It's not a flaw. It's not something that you missed. It's just how the system works. It's how it was built. And so the next two parts I'm going to talk about are designed to fill those gaps for people. So let's talk about Part C for a minute. The Medicare Advantage type versus Medigap and Part D. So Part C is the Medicare Advantage situation. They're private plans that bundle A, B, and sometimes D into one plan. So you have a concept here that takes Part A, Part B, combines in Part C, sometimes Part D into one plan, but it has some extra benefits a lot of times. Dental benefits, vision benefits, sometimes lower premiums, but those require some network authorization, some prior authorization like a PPO or an HMO. Medigap, the supplemental insurance, works alongside your original Medicare, and it covers the gaps, that 20% co-insurance, deductibles, that kind of stuff. No networks are considered here in the situation, so there's no premiums, no co-insurance. There's more flexibility, and it usually comes with a higher premium. The core decision you've got here is Advantage trades lower cost for more restrictions. Medigap plus Part D trades more costs for more freedom. So that's what I want you to look at as we're trying to frame this. There's no right or wrong answer here. You need to decide what you prefer. Do you want lower monthly cost and you're okay with using a specific network? Or do you want to see any doctor, your selected doctor, and pay more for that freedom or that capability? So there you go. Part D, prescription drug coverage. Standalone if you have original Medicare plus Medigap. But if you bundle it all in most Advantage plans, you want to make sure that you understand that you have your own drug list, your own formulary. You check that you need to check and make sure that your medications are covered before you enroll. So the point I want you to understand here is you need to determine what medications you're currently using and which ones are covered by the plan and at what price. What price can I afford them if they're not? The overall thought process you need to go through here is, what can I actually afford on a month-to-month basis if I get sick? A lower premium means you're going to have more risk if something happens. A higher premium is what you're going to pay if you have less risk and some more predictable costs. A couple other things I want to cover. Your initial enrollment usually has to happen somewhere around your 65th birthday. If you miss that, there's potential for some penalties, things like that. So I want to encourage you to verify the exact window on Medicare.gov, since dates are not really personal. They're personal, but they're not universal. That's what I want you to understand. If any of this was helpful, I have put together a guide that goes a little deeper into choosing the Medicare Advantage and Medigap stuff with a worksheet to compare real numbers side by side. I'll put the link in the description. I'm not putting it in there for any pitches of any kind. It's just a guide. If you need it, take it and use it. If you're not subscribed to the channel, hit the like button. Go ahead and subscribe so that you don't miss the production next week, okay? If you have any questions, just drop me a note. Take care. Bill Bergfeld. Bye now.